There are so many layers and angles to helping the whole person. It really takes a winning multidisciplinary team to navigate and serve our patients successfully and properly. We need each other and must go back to a village approach. Our community needs us to win cohesively as we capture behavior trends, clinical data, and potential threats to healthy habits. We must let the good times roll with better healthcare outcomes. We must enhance our flavors with that special root called wellness. As you know, Louisiana, especially New Orleans, has a challenging demographic and high degree of complexity. We must bridge the gaps by reducing complications and minimizing the morbid progression of chronic conditions such as diabetes, hypertension, obesity, cardiovascular disease, and more. Behavior modification, lifestyle changes are so crucial. Let's pull back some of these layers together. So as y'all know, our panelists are here today. One of my patients is here, Lynn Robertson, registered dietitian. I work all the time with Emily Gerrets, pharmacist Dr. Heather Aaron, and tobacco cessation specialist Joy Melerine. This is dear to me. People with diabetes are twice as likely to have heart disease or a stroke than people without diabetes, which is mind-boggling. So, Ms. Lynn, we're going to kick off with one of the major but little known risk factors for heart disease and stroke, diabetes. As I understand, you're here today, a person with lived experience with diabetes. Can you tell us a little bit about your diabetes journey? How did you find out you had diabetes? What challenges do you need to manage? For those of y'all who don't know, there's type 1 and type 2 diabetes, and there's another phenomenon. In the past 20 years, people may know of it, called latent autoimmune diabetes in adults. Type 1 is an autoimmune disease that is attacking the pancreas where you're not making insulin at all. If a person didn't have insulin for a day or two, they could die. Type 2, 95% of people with diabetes have type 2 diabetes. If they work on healthy habits, they can reverse some of the complications. They could reverse being all these different medications, and they're still making insulin. So that is the difference. With latent autoimmune diabetes in adults, some people are getting diagnosed at age 30, 40, 50, 60 years old. There are some research studies on viruses that are attacking the pancreas. When COVID happened in 2020, there was a lot of things that was arising on research articles about possibly COVID affecting the pancreas. So Ms. Lynn, I'll let you tell your story and answer some of those questions right now.
Okay, this is again. I first found that I had diabetes actually at a bodyguard parade. I was with my sister who dragged me to a parade. She's a parade hound. Had a giant bag of beads hit me in the head. And so when I, on the way home in parade traffic, I told my sister, I said, I think I got hit pretty hard. So I got hit pretty hard in the head with a bodyguard pack of beads. And on the way home, the tail lights looked like they had halos around them, kind of like one of those cartoon flower type things. And I told my sister, I said, I think I got hit pretty hard. I'm seeing flowers around the tail lights. And she said, that's kind of weird. Okay. So she stayed up with me, waking me up every 15 or 20 minutes during the night to see if I had concussion or something. And then it was fine. The next day I was fine. And then about a week later, she was in Texas at a conference, and I was the primary caregiver for my mom and dad. And I had taken them to the casino on the Gulf Coast, and I felt really bad all of a sudden and really thirsty. And so then I told Mom, I said, I don't feel very well, and she could still drive. So she got behind the wheel, she drove us home, and on the way home I said, you need to go through a drive-through so I can get something to drink. So I had 2 giant Cokes, real Cokes, not Diet Cokes, and a bottle of water. By the time I got home, I was really feeling bad. Called my sister back, and she said, look, take Dad's glucometer and check your sugars. And my sugars were like 378, which is way off the charts. But previous to that, in the fall, I had a perfect blood blood count. Everything was fine. So we took my, I went to the best, supposedly, endocrinologist in the city, who was a care provider that really didn't care. So he diagnosed me as a type 2 because I was overweight. And I said, I exercise every day, I'm active, I play sand-court volleyball, I've been big all my life, blah, blah, blah. He said, something's not working because the medicine wasn't working. Anyway, I'm trying to shorten it. But basically, my sister found a gal she went to med school with who recommended an endocrinologist here at Ochsner. So I came to see her. She gave me the test, said, no, you've been misdiagnosed for 2 years. You don't have type 2, you have type 1, like the kids get. So once I was finally diagnosed, it was great, and then my endocrinologist moved away. And so I kind of floated in limbo from provider to provider. And then I ended up, thank God, with Ms. Banks, Nurse Banks, who I credit and saved my life, because I was at a 10.8 A1C, and they're going to talk about numbers. And now I'm at a 6.8, probably this next time around, maybe a 7.2. It's been a rough couple of months.
What have you found to really work for you in managing your health? Are there certain activities you have done or resources have you tapped into for your overall health development?
Okay, so I can tell you that my main source, for the nurse educators and the educators, the regular educators of the diabetes department here, the education department is amazing. I still am learning about numbers. All of a sudden, something that one of my educators told me a year ago finally clicked into place when I was in Canada, and I was struggling with my pump because Canadian food is a little different. And so I was having some trouble, and all of a sudden it clicked, and I said, oh, this is what the gal said, this is blah, blah, blah. And so that was the first line of defense, other than having a provider that cares and is knowledgeable about a lot of things. And then the second thing was, I don't know if you guys know, but we have a diabetes support group here at Ochsner, and that monthly meeting has kept me on track. And all the people in our group, we have men and women of all ages, ethnic groups, and it's great because we can share. We go out and do activities together. In fact, we've got a walk coming up soon. So those things are what saved my life.
Can you tell us about what are you using for technology for managing diabetes?
Sure. I think the Dexcom was the blessing of all blessings, because if you felt my fingers, you would feel how rough they are. But since then, I've been using Dexcom, which changes every 10 days. It's a little thing on your body that tells you your numbers. And then in the last, I guess, probably 8 years, I've had the pump. So I have an Omnipod pump, and that technology has proved to be very good because now it talks to the Dexcom, so it makes minor adjustments overnight, to adjust my sugar level. And then that's a lot of why my sugars came down. One other thing I wanted to throw out too that people forget, I'm considered a brittle diabetic because of my stress level. Like when my stress goes up, my sugars shoot up. I mean, I finally proved it to my sister, who is OG of little faith. I kept telling her, I'm not eating poorly. Watch what I eat during the day and then see what happens if I get stressed. And immediately my sugars went up. So another part of it, which I'm still struggling with, is the managing my own stress.
Awesome. Thank you, Ms. Lynn. Emily, we have heard nutrition matters, but we hear a million things about what we're and aren't supposed to eat and how much. How do we know what's true? What does diabetes self-management education entail? What has been the most rewarding moments when working with patients? We hear about how important a low-fat or lean diet or low cholesterol is important to heart health, but we know diabetes plays some role in risk, and that's a sugar disease. And most of the low-fat groceries are high in sugar and carbs. So can you make it simple for us? What is the best diet for cardiovascular health?
So the first question about what you hear all the time, I do have a lot of patients that come in with some misinformation, or they hear from their family members. I'm not frustrated.
That's just close.
Sorry. Can y'all hear me now? I have people that have information from family members that have diabetes, or they've done their own research. I always encourage patients to do their own research, and they can talk to family members, surely, but it's important to let them know that everyone's diabetes is different. So what works for your mom or your sister might not necessarily work for you. And anyone can put anything online. So it's really hard when you try a supplement and it's supposed to cure your diabetes and your blood sugars are still over 14 as an A1C. So kind of giving them direction and where to find research, whether it's the American Diabetes, which website, or social media, have all sorts of registered dietitians that have diabetes that provide a ton of helpful tips when going through their eating out. And even books I recommend following registered dietitians. Maybe a little biased there, but it is kind of a good way to find good resources following medical professionals.
And I guess, what does diabetes self-management education entail?
Yes, so like Ms. Lynn said, I'm one of the educators, so we do not only nutrition education, but medication education, sensors like the Dexcom. We do pump training, so we do kind of a multitude of things to make the patient's life a little bit easier, make it so you're not sticking your fingers a billion times a day or injecting insulin in the same spot over and over again. So finding tools that kind of make their lives easier, help their blood sugars get under control, and see where there's areas that need to be improved. Some people come in and have had type 1 for their entire lives. They're still doing finger sticks and injecting insulin, and their numbers aren't improving. So kind of finding out what the area is that they need to work on. Some people, they're injecting in the same spot over and over again, and it's so oversaturated. And once they switch spots, their numbers look way better. So kind of giving them some guidance.
When has been the most rewarding, opportunities that you see as a dietitian, diabetes educator?
Probably, like you mentioned earlier, with people that their numbers are really high, they don't know what they're doing, and they're doing everything exactly how they're supposed to, and they're just not getting the results that they need. And after working with us and Irielle, and their numbers start to improve, and they feel like they're not as burdened with the disease, and they don't feel like they can't enjoy, like they can't go out to eat with their friends, and making sure they're able to manage it on their own and give them tools for that.
Great. Are you in favor of Mediterranean diet, or like what do you tell patients?
For heart health, I feel like the gold standard, at least we learned, was on the Mediterranean diet. Low carb, lean meats, oils, unsaturated fats, those kind of things. Being in Louisiana, it is challenging to follow healthier diets, so definitely working on mitigating what we can. So especially patients in more rural areas, they have limited access to healthier ingredients, fresher foods, so making sure we can kind of lessen the amount of sodium or carbohydrates that they eat given their income, their accessibility, their transportation difficulties.
Did you tell the patients about what Ochsner Eat Fit? Like, do you guide them with that?
Yes, I use Ochsner Eat Fit, the American Diabetes Association, and American Heart Association have a ton of recipes on their websites to follow. There's cookbooks all over the place, even social media. I do have some people I recommend, certain dietitians or even just regular diabetics, that give some recipe ideas.
Thank you. All right, Dr. Aaron, you're a pharmacist. Describe your role in managing chronic conditions. We know in an ideal world, we prevent these chronic conditions that impact our heart. But if we are a family member or has one or more of these conditions, what can we do now to better manage these conditions or those conditions? I heard there is some new digital technology or program that can help us. What is a digital medicine program? What are the services, and how do they help?
Okay, I'm gonna start from the first one, and I'm gonna start from the top and tell you guys about pharmacists in general, because I think that there's a lot of misunderstandings of what a pharmacist is and what a pharmacist can do. Because generally we think of the pharmacist at our local pharmacy, Walgreens, CVS, and Walmart, and those are pharmacists that dispense medications. But those pharmacists have a wealth of knowledge. And so asking those pharmacists when you're picking up your medications to tell you about it, what side effects you can expect, they're really the best point of contact when you're picking up and receiving your medications, because they have a wealth of knowledge of all the meds that you're taking. They can advise on what you should and should not take over the counter if you're taking certain medications. But there are different kinds of pharmacists. Like me, I'm a clinical pharmacist, so that have extra training in managing chronic conditions. And so our team at Ochsner, the digital medicine program that Irielle mentioned, we work with physicians, we work with health coaches, as Dr. Bryce Haywood mentioned earlier, and helping them manage these chronic conditions like diabetes, also hypertension or high blood pressure. And so with our extra training, we're able to actually manage the medications for patients. The new technology she's referring to as part of digital medicine is having access to Bluetooth-enabled blood pressure monitors, glucose monitors, or even like the that Ms. Lynn referenced. We have connectivity to where you're at home, you're checking your blood pressure, you're checking your blood sugar, or your Dexcom is checking your blood sugar, and we get all that data, and we're able to refer to that to determine how you're responding to your medications, how you're responding to your physical activity or your diet, to determine what changes we can help you make, whether that's increasing your meds, backing off of meds, working with our health coaches to improve your diet or get more physical activity in, and setting goals that you can accomplish to help improve your health condition, whether that's diabetes or high blood pressure. As Dr. Haywood mentioned earlier, also, home readings are the best readings. The more data we get from our patients, the better we're able to help them. So getting one reading here and there in the clinic or one reading here and there at home, it really doesn't paint the whole picture. But if you're able to check your blood pressure on a regular basis a few times a week at home, we're able to really see the impact of what you're eating, how your meds are working, and where we can help you to improve your outcomes. Because as we know, high blood pressure and diabetes, they can all lead to these outcomes that are very high here in the South, and that is stroke, heart attack, and then other things like complications you don't think about, like losing your vision, getting your feet amputated. We want to prevent all of those complications, not just the big things like heart attack and stroke. And then,
I think you answered a lot, but I know that y'all have 4 arms, so it's like blood pressure control, blood glucose, lipid, and kidney disease now.
So yes, so thank you for calling that out. So what we try to do is look at the whole patient. Just because you have high blood pressure and or diabetes, we don't want to focus just on that. We want to focus on managing what happens if those conditions went uncontrolled for too long. So having diabetes for an extended period of time that hasn't been controlled, that can affect your kidneys. Same with high blood pressure, and that can lead to heart failure. So we want to try to close the gap. Ideally, we would prevent those complications, but if we're already there are certain medications that you should be taking that can not only help your diabetes, but can help improve your kidneys. So we want to make sure that you're on the right medication, not just for blood pressure and diabetes, but for blood pressure, diabetes, kidney protection, heart failure improvement as well. So as part of digital medicine, we're really looking at all of that. Like, you have diabetes, you have hypertension, are you on these medications? And then as far as lipids goes, or cholesterol, we want to make sure that everybody who's on high cholesterol is taking appropriate medication. And then what a lot of people don't realize is if you're at diabetes, you should be on a cholesterol medication, no matter what. Even if you think you're bad cholesterol, your LDL is great, we want all diabetes patients taking the cholesterol medication to help prevent those complications, because what we want to focus on is not just improving your numbers, but improving your risk. Because the longer you have these chronic conditions, the higher your risk of getting these complications of heart attack, stroke, and any other things. So.
Can you tell us a little bit about, the health coach approach? I know y'all reach out a lot to these patients. I see the notes. So.
Yes. So in addition to having a clinical pharmacist as part of the care team that really focus on medication management, we rely heavily on our health coaches, and so do our patients. And our health coaches work with our patients to set SMART goals. So these are things that are sustainable, they're measurable, they're attainable, they're trackable. And so something like you come to us and your blood sugar is high, we review your medications, we try to optimize those, and then you talk to our health coach, you review your diet, and we find out, well, every night before bed, I like to have, a cake or a cupcake or a brownie or a beignet, and then every morning I put a tablespoon of sugar in my coffee, and for lunch every day I have, a sandwich on white bread. So our health coaches, and I'm sure Emily sees this as well in her role, we want to help you make those swaps. So let's not maybe cut back on all the sugar right away, but can we use a sugar substitute? Can we eliminate that sweet treat for something like maybe some Greek yogurt with some dark chocolate chips in there? Can we change our white bread to wheat bread? So simple swaps that don't really change your quality of life and what you enjoy, but really helping you identify where you can make those small changes. Or, I'm healthy, but I sit at a desk all day. And so my steps are, maybe 2,000. I have a smartwatch and I check my steps, and so I get 2,000 steps a day. And so how can we more? Does your smartwatch tell you to move every so many minutes or hours? Get up and walk for 10 minutes. Those are going to increase your steps. So those little smart, measurable, attainable goals that you can set and really over time make a big difference. And the more small changes you make, they add up to big changes, and that turns into habits. And before you know it, you're living a whole new, healthier lifestyle.
Awesome. And the metrics, I see about 80% are in goal.
Yeah. We like to toot our own horn a little bit on that. So patients who are enrolled in digital medicine, if you come to us uncontrolled, within the first 6 months, we are likely to get our patients' blood pressure and A1C. About 80% of our patients will get to their control rate with digital medicine. So with usual care, that rate is much lower versus patients who are at digital medicine. We like to attribute that to the CareT model, the health coach, the clinical pharmacist, as well as just the increase in data and patients really being able to see at home what their readings are. Because as a patient, when you are seeing those numbers, and I think Ms. Lynn can probably attest to that, it really helps you process what you're doing and how it's impacting you, and then you're more likely to want to make that change also. So patients who are in digital medicine, we're about 80% control rate for those patients within the first 6 months, which I'm in the program.
Awesome.
And this is one part that I didn't recognize, and it's because it's like second nature to me. The pharmacist that follows me helped figure out how to lower my blood pressure. And then my insurance required a different number on the pill. And so everything was put into flux. And she helped me figure out that if I take it both night and day, that my blood pressure is under control. Even though it was a time release, it didn't work like time release for me. So it works out really nice, and they have been very helpful in blood pressure.
Are you in our program?
I am. I'm so lucky. I'm so lucky to be in that program. And one other thing, if I might, if somebody calls you and says, "Hey, we have this opportunity where you can monitor your progress," jump on it, because that's what I did in the beginning, and I think, knock on wood, my insurance pays for it. So, but it's because I jumped in the beginning, like I think when they first started it out. So
yeah, no, we have examples of patients like Ms. Lynn, and I don't know if this is your story as well, but who come in to manage their type 2 diabetes, and we're really working hard to get their A1Cs under control. Their blood sugars are just not getting where we want to be, and we order some of those tests to be like, I don't know that you have type 2 diabetes. And some of our patients, we have, along with our endocrinology champions that work with us, have identified patients who don't have type 2 and who have the rate autoimmune diabetes in adults or Irielle, and refer them to endocrinology so that they can give the right management. Because part of our program, we're only managing type 2 diabetes, and that's because of the pumps. Everything we do with digital medicine is virtual. All of our contact is telephonic, so we're not able to, use the pumps and program pumps or anything like that. And we also refer a lot of our patients, especially newly diagnosed diabetics, to the diabetes education team, because they're really, really helpful in education as well.
Awesome. All right. Ms. Joy, we've been talking a lot about nutrition, heart disease, and diabetes. We hear about smoking causing lung cancer, But how does it impact your heart and risk of stroke? How does quitting reduce the risk of other diseases and complications? My family member has been smoking for 25 years. Is it too late for them? What do you hear most that is the biggest hurdle for people who want to quit but can't seem to stay quit? How do you help them with that? What has been the main barriers for favorable outcomes?
Or not.
But I can repeat.
That's good. I think that the first thing Andrea had said was the most important, because when I get a new patient, I spend about an hour doing a good background, and I ask them what health problem are they concerned about acquiring as a smoker. And 99% of the time they'll say lung cancer. Every now and then we get one that's a little bit educated, a bit more, and they'll say COPD because somebody else have it. But I tell them heart disease. It's the number one problem with smokers, and they're surprised by that. And I kind of use the same thing that I'm sure that diabetes education uses, like a little graphic, and I tell them that their smoking just really beats up their arteries, and then like a razor blade, and it just shreds it, and it causes inflammation. And we all get stuff in our plumbing, and it just makes a nice ground to have that plaque. That's going to cause us problems. It's going to increase your work of your heart, increase your blood pressure, so it's very rounded. That all this is intertwined. So many of our patients, as well as diabetics, and you know, they don't realize that smoking also affects their numbers. And what you said about stress and cortisol, it's all related to it for sure. The smoking also makes your blood sticky. So there's a lot of blood clots that can happen, heart attacks and stroke. Not getting enough blood flow goes to your brain and cause a brain attack. So all that's related to it, but the good news is the minute they put that cigarette out, the cardiovascular is begin almost immediately. As soon as they put it out, 20 seconds, the heart rate and blood pressure starts to decline already. And I hear that all the time, it's too late for me to do this, and it's never too late. I have a little saying that I tell my patients, it's never too late, because every day smoke-free is a day of healing. I like that too. And it is forgiving because, you know, so many things, once you take away that culprit and you get educated about it, then it helps it. And I think I like our program because it's great. And it said that 60% or more smokers want to quit, but they don't feel it's time. It's never a good time to quit because there's always stress in our lives. And, you know, that's my stress go-to. This makes it all go away. And so it's just learning to replace that, learning to cope with your stress in a new way, not by lighting up, because I promise if you light up and you smoke, the problem's still there anyway. So it's you know, getting with someone to learn about, you know, your lifestyle. Things can change, and they're really surprised that when they're successful at quitting, that they feel good. And they said, I wish I would have did this a long time ago because I didn't know it would be that easy. And I was like, I wish I could show you the white knuckles when you came in that first day, you know. But it's replacing it with something else. And yeah, they often are concerned about their diet. I find only about a third of my patients will gain weight, about a third will lose, and about a third will stay the same. It depends on what they replace it with. You know, if they grab that bag of chips, yeah, they'll make up a little problems there. But if they go take a walk, what do you want, a cigarette? Because it's kind of the same thing. You know, you have to remove yourself from what's stressing you. So go take a walk if you're able to. Or listen to music. You know, do any type of reading. Don't watch the news. But it is obtainable, and I promise they were happy. And like we just talked about, you know, it's really a big problem with our hearts, and we need to check our hearts.
And, you know, with the 25 years, tell us statistically the indications with that. I know we'll see the lung scans that, you know, have indicators.
Yeah. You know, the majority of my patients haven't spoken much more than 25 years. I've had 60 years English. And unfortunately, we kind of look at it like, you know, I've done it too long. Why do it right now? Why do this? Oh, it's too hard. So once you get with someone and, you know, learn how to change those things, then it gets a lot easier. So I always tell our patients, keep at it. 6 to 7 attempts to quit is a kind of the norm. I had a patient just recently, came back through our program, 16 times. The 16 was a charge, she quit. And I promise you, they really do feel good about it. And that, you know, I give them little coins when they quit. And that little coin is like gold to them. You know, they're just so proud of themselves. But no, keep at it, keep coming back because, you know, it's another big deal.
Awesome. Any interesting things like patients use? Because I know some of them say they use licorice or different little
A lot of different
tricks.
things. I get them cinnamon hot toothpicks. Cinnamon is known to calm down the nicotine receptor as well. The toothpick gives them something to do. They chew them up so much, I get a little concerned about them swallowing it, I have to admit. But I tell them we'll have a class on how to get off toothpicks later. But some we use some cinnamon hard candies. Oh, yeah, we don't watch that with the diabetics too. So it's like push the toothpicks to them.
Awesome. All right, so I have 2 more questions for each of y'all. Y'all doing great. If you could only give one piece of advice to your family member who struggles with chronic conditions, what would it be? And what does heart healthy habits and wellness mean to you?
Ms. Lynn.
Okay, I think I would tell them we need to find a healthcare provider that is both caring and knowledgeable, and don't listen to other people when they, I don't know how to put it nicely, but they browbeat you and they say, hey, should you be eating that? Like you're at a party, and you're like, should you be eating that? Well, we are at a party, and I'm not home in my usual setting. I might want a little piece of cake, you know. But other people will like kind of browbeat you, and you're the person that needs to gauge where you are, what you can do, and don't let other people get you down. And at the same time, find a support group that is going through the same thing. Because when I said that in the support group one time, everybody was like, that's what happens to me all the time. My son, my daughter, they're just bragging on me all the time. And I said, it's okay, you need to just, you know, mind your business. I was to say, that would be the advice, but find a caring and knowledgeable provider or a team of providers. I mean, I'm so fortunate.
And then the heart healthy habits, like what, you know.
So my heart healthy habit advice is, if you can, walk, and if you can't walk, swim. Because I don't actually swim like a swimmer. I go into the pool because I have knee problems, and I do a workout that keeps me like aerobic, friendly, and also gives me enough weight bearing because I have these styrofoam things that I do, and it gives me enough weight bearing to make sure I don't get the osteoporosis.
Awesome. Emily, piece of advice to your family member who struggles with chronic conditions, what would it be? Heart healthy habits and wellness, what does that mean to you?
I opted out of tag team with Ms. Lynn and finding providers that work for you. There's all sorts of providers, and the first provider you need might not be the one that matches your personality and your needs. So sometimes it takes a few providers to find who fits your personality, fits your needs, and is making good progress with your effort that's in help. And exercise as well as watching your diet, but realizing that no one's diet is perfect. You don't need to be overanalyzing everything that goes in your mouth. And there are events that come up like birthday parties and anniversaries and cruises. And so finding kind of a balance between enjoying foods they eat, but making sure it's not a huge cheat day or a huge cheat week. It's kind of having one meal that you enjoy and then moving on with the rest of your life.
Awesome. Ms. Joy? If you could only give one piece of advice to your family member who struggles with chronic conditions, what would it be? And what does heart healthy habits and wellness mean to you?
Have to breathe. Because finding that right person that hears you, you're all individual, and you know it takes time to change a lifetime of habits, and you know just like my patients, they surprised when I tell them, "Oh, you have this problem? Did you try this?" I didn't think of that. And I'm like, I do this all day long, you know, and somebody else told me that. So hang in there, keep doing that. Heart healthy habits. We have to live and give ourselves, with my patients, fall down because, you know, they've learned to cope. I just take their friend out and take their friend away now so they breathe a bit. But it's a great time to find a new hobby, a new thing. I asked them, what's on your bucket list? You gotta fill that void with something, so fill it with something that's gonna make your heart happy. You know, you won't miss that so much because, you know, they really don't like smoking. And I asked them in the beginning, they give me 3 reasons why you don't want to smoke anymore. Oh, they'll go to town, you know. So they really don't like it, but they feel like they're stuck there, and you have to give up. Just keep going. They fall down. If you wake up the next day, just brush yourself off and start again until.
Awesome advice. All right, Dr. Aaron.
Yeah, I think I need the questions again.
No problem. If you could only give one piece of advice to your family member who struggles with chronic conditions, what would it be? And then what does heart healthy habits and wellness mean to you?
Okay, so I'm going to tag team also on the healthcare provider, and I'm also going to do a shameless digital medicine plug, because I think part of the reason we are very successful is we have an amazing team that truly listens to our patients. You know, we here manage your hypertension, diabetes, lipid for the most part, but like if you come to us and there's another problem, it's likely we're going to try to get you where you need to be for that problem too. We prefer patients to Ms. Joy's team for smoking cessation. So finding that group of providers, even if it's not just your primary care doctor, your cardiologist, your endocrinologist, just, you know, a healthcare team or a healthcare system that will listen to you and allow you to be heard and make sure they're taking care of your whole person and not just what appears to be the initial problem on the surface. So just and then as far as my heart health tips, it's for sure moving and staying active in whatever that means for you and however you're able to do that, as well as like the 80-20 rule, and something that we got our patients in digital medicine, because a lot of things we get, well, it's really hard for me to follow, you know, a specific diet because it's the holidays. I'm like, well, we live in New Orleans, so it's Mardi Gras, or New Year's, and then Mardi Gras, and then Easter, which is like crawfish boil season, and then next thing you know, it's like Jazz Fest, and then it's 4th of July, and then we're to Thanksgiving and Christmas. So it's always a holiday. The holidays are like 1 day, 2 days, so like enjoy those times. But like, you know, Thanksgiving is on Thursday, we'll eat leftovers, but like on Monday, let's get back to our normal routine. 1 meal, 1 day, 1 weekend of meals doesn't have to like throw off your whole progress. So enjoy that time, enjoy your birthday, enjoy the Christmas, and you know, whatever holidays it is you celebrate, but then get back on track when that time has passed.
Awesome. Thank you, Dr. Aaron. So it sounds like it's all about finding that right team. So that's the pros I see and how you manage. I feel like stress, sleep, and when you have that sickness, it makes a difference for, you know, healthcare outcomes. Questions?
Tanya. I'm not as old, but I got maybe and papers and the with sex that it isn't and bad for their home. I Swiss fish. And field out a lot of people in the medical field out you of course they die. But you know, the data is out there already. It causes just as much inflammation on the heart and the duffels, just like smoking. So you don't get carbon monoxide. That's one plus. But you do have a lot of other problems. Mine is because I'm respiratory therapist first. And our lungs were made for air, nothing else. There's flavorings and such that's leaving. And I used to tell my patients not to switch, but that's not quitting, it's switching. Not to switch, to quit. Because, you know, the effects of it and the data's not here yet. But now I've changed and it makes the habit worse. Nicotine is a third most addictive drug out there. And people that vape do it everywhere. Don't walk around with it in their hand. And most smokers are smoking outdoors now. But if they vape, the vape much more and more nicotine, and you can't measure how much they're getting. So it's much harder to quit vaping than quit smoking. There's 25 of us counselors that Ochsner, the smoking cessation. We all agree on that. It's much harder to get someone to quit vaping than smoking. Other questions?
Coming back on what you're doing, how do you address a fan, a member, or a friend? What about the person who don't want to get help? Someone who maybe need help, but probably feel like
Any smoking?
in regard to
I think some of it is education. I don't think that everybody is aware of all the things. I have an uncle who's been a smoker for my whole life, and he said his thing was always, something's got to take me out. And I was like, well, what you, as an educated adult and clinician now, what you don't understand is that stroke and that heart attack might not take you out. And that, to me, is the scariest thing of living through a stroke or a heart attack with all the deficits that you might have. And what that is going to do to your family. The occupational therapy, the physical therapy, the not being able to walk or teach yourself or speak. And that is now your life. So just the education of like the detriment to not addressing the chronic condition or the smoking or whatever it is, it's much greater than just, well, something's got to kill people, but it might not kill you, and think about what it's going to do not only with your family and those got to help take care of you also.
hey,
Yeah, I never tell my smokers to say, I never point to things and say, you have to do this. Because to be a smoker today, you have to have a lot of rebel in you. To start smoking, you ended up in live. But to survive smoking today, you have to have a lot. And you never tell a smoker and shake your finger at them because they'll light up right in front of you. But like I said, more than 60% of smokers want to quit. Most papers out of it reluctant to take that step. So all you can do is be there to support them, but don't nag them. Fine line between nagging and supporting. So be there for them, and exactly what she said. You know, sometimes don't do it for other people before themselves.
Like just finding equipment to be to them, I think is like the summary.
One thing one of my friends did, not to interrupt, I'm sorry. One of the things one of my friends did, because I love to cook, and when all of this happened, I was using butter, like on the pound, like we all do. And she came in with her husband and she said, look, we're going to show you what we do to keep our heart from shape. And she showed me how to cut the butter to just get the flavor of the butter and use olive oil and so that kind of support, like a positive support, say, hey, look, I was talking to this dude at work and this is what he said to do in terms of, you know, cut factor, fat and cholesterol and your starches. And other starches, like the complex starches, instead of the simple starch. I mean, that's to actually work a recipe, you know, from something other than smoking, you know, like that is what it consult. I mean, but
Yeah, our clinicians keep reaching out, and we have great community workers that try, and then we try to get them to the educator, and then we try to sometimes tag team and go and visit with the educator to see all what's happening or the misconceptions. So it just depends on what chronic disease they have. But we do a lot of reach outs, and hopefully they give in eventually, you know, or a family member come with them.
yeah, that's
Any other questions?
what time.
Thanks for having us.